Questions being raised today over reports that several patients walked away from the Center for Addiction and Mental Health, CAMH. Now, on Breakfast Television this morning, we spoke to defense lawyer and mental health legal expert Robert Karras about the situation and how CAMH is handling it.
So not criminally responsible is really a designation that happens when a person has engaged in activity that we consider criminal, but because of major mental illness, they've been robbed of the ability of knowing right from wrong and knowing the consequences of their actions. It doesn't happen often, but when a person is designated NCR, they're not found guilty and they're sent to hospital for treatment. What happens after a person is found NCR is they become subject to the Ontario Review Board, and the Ontario Review Board is a body that's put in place to determine whether or not people continue to pose a threat and at what point that person can be reintegrated into the community. While they're in hospital, however, the hospital is responsible for doing daily safety assessments really to determine whether or not this person should be allowed into the community on a pass, given their security level.
And the whole idea is rehabilitation. It's not to lock them away forever.
100%. We don't have, lock them up, throw away the key in Canada. So the idea that a person who has mental illness is sent to hospital for treatment, the goal is treatment and eventual reintegration into society.
And is this common that patients walk away, or is the success rate of this system quite high?
The reality of the situation is there are hundreds, if not thousands, of passes that take place on a monthly and annual basis. There are lots of individuals in the system who are released on passes, and for the most part, it's successful. This month, it's been a bad month.
And will they review? Is there anything you think that could be done, or from what you've seen with the system, does it seem to be working well, or are there changes you'd like to see?
I think for the most part, the system works. Obviously, we have issues happening this month, and that probably brings under scrutiny what factors are being assessed when a person is given a pass. But the problem is that there's always going to be a graduated system. So eventually you go from being in a locked seclusion area to being put on a general unit to eventually being monitored in the community to eventually unmonitored passes into the community. And that system is supposed to take place that way, right? The goal is that reintegration while treatment is ongoing and hopefully treatment is successful. So the question is, when a person is being given these unmonitored passes into the community to go down the street to the Tim Hortons and come back, what is in place to make sure that they are coming back and that the police are notified quickly enough when they don't come back?
CAMH is working with police to locate the missing patients and also saying that they have started an external review of how patient passes are handled.